Hey everyone, welcome back to Shock Doc Medical. I'm Dr. Rod. Today, I want to dive into an article that really got me thinking, Rethinking Hypertension Care in an Evolving Landscape by Lindsay Coulter. Now, before we get into the nitty-gritty, let's take a moment to appreciate what makes human conversation so uniquely powerful. It's not just about exchanging facts, it's about empathy, nuance, and connecting over shared challenges. And that's exactly what we're doing here today. The article brings up an interesting point from Dr. Eugene Yang, a real-life rock star in the world of cardiovascular prevention. He's always wrestling with those tough decisions, like when to scale back or even stop antihypertensive medications. And it all boils down to a delicate balancing act. For instance, think about his point on age. For older adults, life isn't one size fits all. One octogenarian might be out there playing pickleball 3 times a week, while another could be struggling with severe dementia. Dr. Yang reminds us that sometimes our goal shifts from prolonging life to simply making it more comfortable. I find that really human, acknowledging that behind every blood pressure reading, there's a person with unique needs and stories. It's like how in our own conversations, we pick up on more than just words. We sense the tone, the emotion, and even the hesitation that might hint at deeper concerns. And speaking of deeper concerns, the article also touches on a critical issue, the need to update our guidelines. The American Heart Association and American College of Cardiology set the benchmark in 2017 with the 130 80 mmHg cutoff. But things have evolved since then. Dr. Yang and his colleagues are nudging us to consider the real-life scenarios of older patients, factoring in things like frailty and overall functionality. It's a call to be more flexible and human in our approach, rather than just following numbers on a chart. I know what you're thinking. Numbers and guidelines can feel so impersonal. But here's where human conversation really shines. By sharing our personal experiences and acknowledging that sometimes a little skepticism is healthy. Both parents and clinicians, as noted in the broader discussion around hypertension care, often view high blood pressure in older adults through a lens of caution and sometimes fear of side effects. It's that natural human instinct to protect what we hold dear, whether it's our own health or that of our loved ones. Now, another fascinating aspect of the article is the recent study from Seoul. It suggests that gradually reducing hypertensive medication might not lead to the dramatic blood pressure fluctuations we once feared. In a study involving older adults with an average age of 66, patients who tapered their medications did see a slight rise in home blood pressure readings, but not in the controlled clinic setting. This research is a perfect example of how science is continually evolving and reminding us that our bodies and our lives are dynamic. It's a reminder that managing hypertension isn't just a checklist. It's an art that involves listening to your patient, understanding their lifestyle, and even considering their emotional and physical comfort. And that's what I love about our conversations on Shock Doc Medical. We're not just here to regurgitate facts. We're here to connect, to share insights, and to remember that behind every statistic is a human being. Whether it's discussing the importance of accurate blood pressure measurements, with proper cuff sizes and all, or navigating the complex world of comorbidities like obesity, diabetes, and hyperlipidemia. Our goal is to make this information relatable and actionable. Before we wrap up, I want to leave you with a key takeaway. In an ever-evolving landscape of hypertension care, the real progress lies in our ability to blend hard science with human empathy. We need to ask ourselves, not just as clinicians, but as people, how can we tailor our approaches to truly meet the needs of each individual? And that, my friends, is what makes our conversations so powerful. Thank you for joining me on this journey through the evolving world of hypertension care. If you enjoyed this discussion, please hit that subscribe button, leave a comment, and share this podcast with your friends and colleagues. Until next time, I'm Dr. Rod, and you're listening to Shock Doc Medical, where we keep it real, personal, and always a bit human.